this morning for a few minutes before this starts. So Bailee and I, my name is Jennie Garner. I'm the director at the North Liberty Library in Iowa. We have been closed since March 16th, and we have no opening date on the docket yet, although I think right now we're leaning toward July 6th as our soft opening with limited capacity and limited other things. And I'm going to pass it to Bailee, and she's going to introduce herself and introduce the topic, and then we'll just get rolling. When we figure you guys will all keep the conversation going, we're just here to help guide it. If we run out of things to say, everyone knows me, or if you don't know me, you'll learn that I don't ever run out of things to say. So that's my purpose today.
Oh, I love it. I'm Bailee Hutchison, and I'm a branch. I was like, wait, what do I do? Oh, I'm a librarian. I wear a shirt to remind myself what I do. I'm just kidding. Branch manager at the Altus Public Library in Altus, Oklahoma. We've been closed since March 18th, and staff returned May 4th. And then we opened to the public with limited services May 18th. So been open for almost a month now with limited services. It's been interesting. Our topic today, though, is mental health and mental health of your staff and yourself. And we kind of talked about this at the beginning of all of this. I think it was Jade and I, actually. We had this topic. It was like shortly after COVID had happened. And I'm very interested to see, now that we're kind of maybe settling into a new normal or just adapting to what's going on. This has been going on for a few months now, where we're all at with that. You know, what are you doing individually to help keep yourself sane and to support others? And so just want to, this is my cup that I use every day. It says, "You got this." It's always a good reminder. I like having little positive notes around like that. So kind of want to open up the floor or the Zoom room for that.
Well, to keep sane, I'm avoiding reading comments on Facebook. I sort of stay with the people that I trust, that I know have sense. Once in a while, I get drawn into one of those controversial discussions, but mostly I'm trying to stay with people I'm comfortable with when I'm on social media. I'm finding it really hard to read, so I've been listening to a lot of audiobooks when I have time. Disaster reading and true crime, maybe to remind myself that we can get through anything.
I've heard a lot of people say that they normally don't read apocalyptic fiction, but that's all they can read now. So everybody does what works for themselves, I guess.
Well, I will jump in because we had 2 seconds of silence. I personally thrive on chaos. I've told a few people, if I can't be around people, chaos is my next best energy source, my next fuel. I actually was just telling these guys, the early comers, that I have a hat that says I run on coffee or caffeine, chaos, and cuss words. So that actually hat was made for me. My friend got that hat for me. So that being said, for me, this COVID, I thought it would be harder because I'm so social, and I actually have found it interestingly not difficult to be quarantined and to go through what I've go through this, probably because of the chaos factor. But I have had friends, and maybe it's because we're working. I'm talking generally in this group that we're still working. I've had friends who are not working or had their livelihoods ripped out from under them. And what I've heard from multiple people is, I can't stop crying. I've been crying all day, which is a horrible thing to hear. And it's a horrible thing to try to support. So I think going from that, how as managers and leaders and directors and coworkers, what have you found successful? My question for you guys is, what have you found successful to help support your coworkers, your employees through this? Because I found early on that was what I was spending a lot of time doing, was acting as support for people who work in the library with me, who work for our library, and trying to figure out ways to help them navigate an unknown when I couldn't give them answers. So I'm really curious to hear what other people have been doing to help with that kind of thing.
I think for us, it's just been having an open dialogue, like having a safe place to talk about these feelings. That's really helped, I think, our staff. For short answer.
I'll join in with the dialogue part. We have been in the building, the staff has, throughout the quarantine, but the public hasn't come in yet. Monday is maybe the day that we're going to start letting them in, but just the chance to talk about it behind the scenes. We can sit down, we have the time, the space where we can sit down and talk about it. And especially now where we're getting ready to reopen and all the unknowns of what that will bring, how it's going to play out and what's the best way to deal with it. We've had a couple confrontations with some patrons over the phone, and we had one almost physical altercation with a patron out in the back. So we do know that tension is high with the patrons, and so we've just got to be ready for anything and ready to diffuse it. And so with us talking about it, hopefully we're on a level playing field when they come in the door.
I know it was mentioned Netflix party and planning some social time. I will say that has been really helpful. We've done more fun things, I feel like, since we've gotten back. Like, not that we weren't fun before, but just taking that time to like, we did Taco Tuesday, like, and actually brought tacos in, and actually allowing that time for staff to connect, because it's so easy to get just busy and us get zoned in on our jobs and serving our patrons, which is very important. But it's been nice to almost build this new cohesiveness within the staff during this time.
So one thing I'll mention we have daily Zoom meetings every day. Sometimes it's 15 minutes and sometimes it's longer, depending on what information I have to provide to them about where we are with things. And other days it's just each person going around and saying their piece for 5 minutes and we're out. It's helped a lot for us. And I asked them if they wanted to stop multiple times. Every time I'm like, do you guys want to go down to once a week or twice a week? And everybody's like, no, we need to keep doing this. So we work half and half. Our teams we're in half of our staff comes in every other day. So we haven't seen our coworkers since March 13th. And that's, I know, been extraordinarily difficult. We're a very collaborative team. We work a lot together and we sit in our spaces. It's an open space with 10, 12 staff always in this open space at their desks where they can talk across to each other. So that's probably been one of the most challenging things on our side. And the other thing is that one of the things that I told my staff early on, and I may have said that in this room actually, was I brought every staff person in and had just a conversation with them a few weeks ago, just asking how they were doing a check-in, an emotional and mental check-in. What can I do for you? What can I do to continue to support you? And then I just said, I want you to all give yourselves some grace. I want you to know that if you're not working a full 8-hour day when you're at home, because we are working from home, that it's okay. It's okay to take a walk. It's okay to sit out back and have a cup of coffee or a cup of tea midday. That's about as strong as you get, but please, while you're working, but it's okay to give yourself a little room to not do all of it. And I think that's been helpful for our team to just feel like they're not pressured and to feel like priorities have to come in the order that you feel you can handle them. Anybody else? Any more wisdom, please?
I would say my district has done very little of that, at least with the branch staff, where everybody works alone anyway. Up until 3 weeks ago, we weren't even having regular Zoom meetings. It was just like, clean your branch, keep the doors locked, work if you want, don't if you want, check your email when you feel like it. And that was for like a 3-month period. And even though we're used to working alone, we're used to working much more collaboratively, I would say. Now, the main branch, I think, has dealt with this differently because obviously it's got at one time 10 people, staff in the building. So I think that they've been more supportive of each other. And I don't feel like I'm totally left out in the cold. I just feel like the focus, especially since we're changing directors, was trying to figure out and trying to write new policies, and the full-time staff was really engaged in that, and I understand that, and rules were changing every day, and they send out something, and then half an hour later they'd have to send out a retraction. So I don't know. I've been taking way more walks, which the dog likes. And my community's been really good about everyone wearing masks inside buildings and stuff. So I feel like my community rather than my district has been more supportive. And I haven't talked to other individual librarians to see if maybe they're getting a different feeling. But I don't know. I mean, I think every district is so different, especially if you have a lot of individual librarians that work solo. But, you know, I'd be interested how others who work solo feel about that. Are you feeling even more solo, I guess?
Yeah, I'm pretty solo. I do have an assistant, but we never work at the same time. We have actually probably talked more during the pandemic than on a normal weekly basis because there's just so many things to talk about. We're getting ready to open on Monday. If it were just my local community, I would be totally comfortable, but we're a tourist destination. So we have people literally from all over the world coming to our town. And that really makes me nervous. We're only open by appointment. People can only be in the building for a certain amount of time. It's a small space, so only a few people at a time. It just really makes me nervous. We'll be putting sneeze guards up, and everyone's going to have to wear a mask, which is going to make a lot of people here angry. But we don't really care. Both of us that work are over 60. Phil is approaching 70. We just really have to be super careful, and people are just going to have to respect that, I guess. And we already have people mad that our meeting room is closed. We have people mad that we're not doing programs in person. I don't get it. I guess they don't follow the data or something. Anyway, so I'm just kind of nervous. I am super, super happy I live where I do, where every night I can get down to a creek or a river, and that helps let everything go. Just super, super grateful for that.
Jane, you just led to some of our other questions actually that Bailee and I kind of worked up, but I did want to say before that, I just wanted to cover that Patty was mentioning in the comments that they did with their meetings with their staff. They did activities like show and tell and games, and talked about what they were reading, talked about their fears and concerns, and that helped them get through a lot of this stuff. And then Kate brought up Zoom fatigue, and if you haven't seen it, Bailee shared an article about Zoom fatigue, which I think is interesting because I'll tell you what, I do have Zoom fatigue, and I wondered, so I'm really anxious to read the article actually, because I have literally not been out of Zoom meetings today since 9 o'clock except for 45 minutes. That's it. I ran to lunch. I actually left the building and went to lunch because I was like, I've got to get out of this building. So I get that and I'm excited to read it. But I wanted to share with you, since you're talking about masks really quick and I didn't want to lose it. We found a sign, someone from Iowa shared this with me, and it's so simple. It just says mask on, sanitize up, spread out. And it's going on the door, and it'll go on our doors too. We are requiring masks, but we're just saying grab a mask. You know, we're going to have them available, or they can, if they don't have them on, we'll be greeting them at the door with us. And I think that is another challenge. And that brings me, I guess, or Bailee might want to, do you want to jump in with your question, and then I can ask you.
Oh, there's the unmute button. The individual, like, what are you doing individually? Yes. Okay. Sorry. I have like 4 questions written down.
Since Jane was talking about going to the river, I was like,
yeah. So what do you guys do individually? Like, what is your happy time? What's your de-stress time? I mean, because I know like sometimes maybe you are going from this to then maybe you have kids at home or grandkids or stuff. And so we all need our own time. What helps us de-stress? I've started doing yoga, and that has really helped me. That's kind of been like my own personal time, and just a time where I can just like, I don't have as beautiful scenery as Jane does. I do have beautiful sunsets, which when I get to catch those are really nice. But yeah, what is working for you? What helps you kind of let everything melt away and recharge for the next day?
Hi, I have an odd thing that has really allowed me to feel much less stressed about all this. I've been listening to the meetings of our county supervisors. So in New York State, you have a town supervisor, and they all get together in their meetings at the county, and they are less aware, in control, etc., way far behind libraries. Our officials and small businesses, especially the small businesses who are trying to cope with all this stuff, libraries are light years ahead. And when I listened to that meeting, I realized that a lot of the stuff that I'm stressing about, we as a profession and we as individuals are much better prepared than individual business owners, than a lot of county governments, than a lot of the things that are happening. So it kind of made me feel much less under pressure to do more and more and more and more and more things and get everything right. And, you know, we're all doing the best we can. And it's not yoga, but man, that took a load off my mind.
I'm just reading through some of the comments. How are you guys monitoring keeping only a certain number of people in your building? I would say Judy Leonard shared something the other day that she found, which they just bought some little circular numbers and with key rings basically, and they bought a display and they have them hanging on there. They pass someone a number, log the time they've come in, and then when their time's up, they basically find them. Or we have a paging system, but shout out, you know, time to check out and get out. Not that way, but you know what I mean. So that's one of the questions. Does anyone else have another way that they're doing that type of thing?
I was going to expand on that a little bit. I did see Judy's keyring display, and that gave me the idea. We can only have 10 people in the building when we open on Monday. So we're going to make little business cards and laminate them and hand them to the patrons as they come in. So when all 10 cards are gone, then we know that there are 10 people in the building. And we'll write their time arrived on the card and on a sign-in sheet so that they know, okay, I've been here 30 minutes, it's time for me to go back out. And then by laminating them, we can clean them between each user so that if they are high touch, then we're able to sanitize everything.
I'm just reading through some of the other comments too. That's a great idea to do the writing on it. Thanks for reminding us that it's okay to break down. That was one thing, and somebody else said they just allow themselves to break down as needed, which I think is also really important. Intentional grieving, Bailee says, is healthy for you. It allows you to break down or do whatever you need to do in order to reset. Somebody made bookmarks with a clock face on them so they can write the time, so similar to what you just mentioned. And there are some places only allowing 3 people in their building, so it's all different levels of stuff. There was something up above that I was trying to find again that I read, and something, you know, I think that must be, that is all of them. Oh, and you said, and I think it's interesting, this is another thing, Bailee said that they have to urge people to wear masks because they can't legally tell people to wear masks. And we had the opposite. Our city attorney said you absolutely can tell people to wear masks as long as you're providing them equal service and you're telling everyone to wear a mask. So we have, that's his view, that's his legal view. He did defer to us. So in Iowa, apparently, supposedly, at least we think we can, as long as and we'll provide service. We'll give you curbside. You just can't come in our building unless you're willing to wear a mask. And I know we have staff who are anxious about that, asking people to do that too. I think it's interesting, somebody said that their county was behind. I think it was you, Annie, that said your county's behind what libraries are doing. And I just want to tell you, my brother has been traveling and he'd gone through Albuquerque and they were very intentional in their travels. He's a physician, so knowing where to go and what to do, and they wear masks. And he said in Kansas, you guys from Kansas, that there was not very many masks being worn, and they went someplace and somebody had a mask on and he thanked them for wearing a mask. And they said at another stop that they had been on, they said to the attendant, "No one has to wear masks here." And the attendant said, looked at him like, "Why?" And he said, "Well, that COVID, you know, the COVID." And he said, "Oh, that was a couple of weeks ago."
This is Patty from Kansas, and I have to respond to this. I have a friend that was going home to Dallas. She came to stay with her folks for about 6 weeks. She left on Sunday, and she said, she talked about the trip up, how everything was pretty much shut down. Every rest area, and there was the occasional Love's that had a truck stop where she could actually use a restroom coming up. But going home, she says, every place in Kansas would let you use the bathroom. She says, Oklahoma was a little later. She says, we got to Texas and it was like, you just hold it. There must have been a sign on the highway. But it's like everyone has just forgotten. And even with our own staff, we came back last week and did a bit of curbside. But this week our doors are open because we had an interesting situation with our governor and how power changed and all this. And so our doors are open and it's like regular business, and we can't even get all of our staff to wear a mask and help clean up at the restrooms after they use it. And so it's so frustrating, and I live alone, and so I love people, but man, I'm ready to go home by 5 o'clock.
I don't remember who made this comment, but when our board met, we had the discussion about requiring masks, and somebody said, well, if we require masks, don't we have to have them to hand out to the people? And I was like, well, we require shirts and shoes and we don't have those to hand out to people. So anyway, we are going to try and find a source for masks to have on hand just because we want people to wear them. And yeah,
I love that, Jennie.
it was a really good point too. I was like, well, hey, no kidding. Anyway, some
That
people
makes
don't get that.
Jane, I can find out from our city administrator, she ordered, our assistant city administrator, 7,000 cloth masks from somewhere that we're going to be using. We're not giving them away. We're having them use them and throw them in a bucket. We'll be washing them with bleach every night, but I will try to find out what that source is for you.
Yeah, I would have to have my assistant wash them. We don't have washing facilities in the library, and yeah, I don't either.
And the paper ones are, yeah, the paper ones are also another option. We have some that we got from the EOC, but they won't let us use them. They can only be used for staff.
Huh.
They gave us hundreds of them, but they said only for staff, which I found interesting. So we need to find another source if we want to give those away. If anybody has a source, maybe share it in the comments for people if you know some place to order. Does anybody else have anything that they're thinking of right now that they just want to get off their chest? We have more questions, so we'll just keep firing them at you unless somebody has something they'd like to discuss specifically about this subject. If we go back to the mental health subject. Well, my next question for you guys is anyone doing something on the other side, which is asking, what are we offering resources to our patrons for mental health? Are you sharing online resources? Are you sharing insights on that? Are you doing programs surrounded by mental health? I'm really curious about that. And the things, it's not something I had really thought about until we started discussing this, to be honest.
Outside of just sharing a couple of articles on our Facebook page, we haven't really done much. And I honestly hadn't really thought about it either until we were talking about it this morning. And I'd be really interested to see like what type of virtual program covering this topic, how that would go over in our community, because we have several patrons that we've called and talked to that haven't still been able to get out or don't feel comfortable coming into the library yet. And they just want to talk. They're just kind of lonely. They miss coming into the library physically. They miss holding a book. They miss browsing. And it's like you don't realize how important that part of their day is until it's not there, and then hearing them talk about it.
Kate just brought up a good question, that is, as patrons return to the library, including people who've been sheltering alone or just hungry for interaction, have you run into that where you just can't get them to not talk to you? We've run into it on the phone. We're finding it harder and harder to get off the phone with people when they call in with questions. So that's been interesting as well. How do you divert that when you're trying to answer the phone all day long and you've got 3 phones ringing or 4?
I was on the phone a good 3 out of the 4 hours that I was here yesterday. It was just, yeah, I don't know if people are just getting to that point, but I was like, all day. And I'm probably just as bad as the patrons because I miss visiting with them.
We've also seen it with our curbside deliveries. The patrons are very happy to get the books, but they're out in the parking lot, out in the driveway. You know, we can't wait to come into the library. We can't wait to see all of you at once. So I'm sure that some of that is an interaction factor, that they just don't have anybody with whom they're comfortable reaching out to like they do the library.
So I've started to wonder how we can turn all of this, both the anger at what we're no longer able to provide and the joy with the things that we can provide, into messaging for our libraries. Like, the reason that you're mad at us is that we're not doing all the wonderful things we normally do. How much do you appreciate the wonderful stuff we normally do so much that, it's a hole in your life when it doesn't exist. I think probably everybody here is going to be struggling with funding in the coming months and probably couple of years. So I'm already in my devious, small nonprofit director mind thinking, how can we make sure that people, instead of saying, I'm so mad they didn't do it, say, oh, I wish they could do it because it's so wonderful. And turn the message into something that's going to be good publicity for us. I don't know actually how to do that because I'm not actually that good with people, but it is a question that's in my mind.
One thing, and it's kind of a fine line, we're a municipal library, so the city government makes our decisions for us and then we follow with those. So in some ways we want to say, tell this to City Hall, because we want City Hall to know how you feel about us and how much you value the programs and things that we have. But on the other side, City Hall is like, don't send your complaints to me. We don't want to hear them. And there's some friction between us. We're often the redheaded stepchild anyway. But so trying to get so that it's not a complaint when they go to City Hall if they can make it more positive and look how much we've missed the library, I think that would help a lot, is to get the message to the decision makers.
Does anybody have that challenge? I personally do not have that challenge. I'm very fortunate with this and extremely lucky to have a leadership team that values the library as an essential service, or pretty much does. So I mean, my only answer is to continually, I shove that down their throats constantly, and they just have to take it with a spoonful of honey, because that's just the facts that they need to learn. I mean, I think making ourselves essential includes, for us, it was a switch that flipped from years ago when we used to always sing our own praises and say, here's what we offer in our library, here's all the great things we give you, to saying, what do you need from us? And once we started offering that, we got invited to the table so much more often, because they found that when they told us this is what we need, we were able to provide it 100% of the time. We can do that for you. We can do that for you. And that's always the case with libraries. That's how we operate. So I think it's letting them know that anything that they need, you can do it. You're all, I mean, we are all very extremely capable and very well positioned to be leaders in our community. So we just have to make ourselves that way, I think. I can't keep up. I'm trying to keep up with all the amazing the comments going on too while I'm talking. But
well, to piggyback off of that, Jenny, on the I put difference between outreach and engagement. I remember learning that at a session that I went to, and they were asking like, how well do you think you are doing in engaging your community? Everybody's like, yeah, pretty well. Well, we realized what we were doing is more outreach, because we were saying, here's all the programs we have, or here's all the resources we have for you. And we weren't going that extra step to actually engage our community and see what they needed and how we can meet that need. And I think during this time, it's almost made us have to do that, because all of our normal resources, most of our normal resources or programs we're not able to do. And so, I mean, at least for me, it's made me really step back and be like, okay, well, this isn't about what I feel like I can offer. I need to know what my community needs and how the library can make that happen, how we can fill that gap for them. It's been helpful to change that mindset.
I'm just catching up with some of the conversations going on in the thing, but I think I've lost my way because I'm further up than I need to be. They're talking about getting masks from Quill. One person is. And then somebody said, Terry said that she had links on her website sharing resources for mental health in their community. That one I don't think I touched on. They just were talking about different places requiring masks. And the curbside question, sorry, I'm just reading back through these. Somebody wrote, oh, there it is. That's one I was trying to find. Great question. How can we turn awareness into an awareness and advocacy moment for our communities to know all the things we do? And I guess, let's see, did anyone see the results of the PLA survey? Love the line in the report that said we are second responders, vital second responders. I love that idea. And then we're back. I think I'm at the end. So yeah, I mean, I think Bailee, did you have other questions? I'm getting lost.
I had a question. It kind of touches on what Emily Hart had said about her having to go from a curbside handoff to no contact. Because especially for those who have opened, even with limited services, how has anybody struggled with the fact that it is hard to kind of politely extract yourself, or politely, I feel like how can I equip my staff to let them know that they can say, okay, we have to adhere to this, these guidelines. So we put the markers down. We have a thing installed on our circulation desk, but like we've said, our patrons are starving for that interaction and to be able to talk, and some of them don't have as good of a sense of physical space boundary. So has anybody struggled with that with curbside or even in their library?
Honestly, I think it might be the other way around. They're like, how can I get away from the librarian? She followed me out the door.
That's funny, Jane. Ours is
Today was actually, oops, sorry. Today was actually my worst interaction this morning. I had a lady come in and wanted to use the computer. She said, do I need to buy one of these masks? And we have some donation masks that a community member had made, some cloth ones. And so I said, yes, please, we would appreciate it. But then she's on the computer with her mask on, and 3 little old ladies come in, and not one of them had a mask on. I'm in my office, I'm closing my door, I'm back in. And here these ladies stood here and visited. And they're like, oh, but we're 6 feet away from each other. And I'm looking at them going, no, you're really not. And it's so hard to say, get out unless you have a mask. Especially to my little old lady regulars, which they're the ones that need it the most. But yeah, so that was the worst, and I've been open for 2 weeks now, and before today, most people have left as soon as somebody else comes in. It's just, they've done it on their own, and it's been wonderful until today. So I think somebody said earlier how people are like, oh, it's over, but it's not. And I wish people would wake up to that fact.
Yeah, people here are the same way. That, like, I don't know if they don't care, or yeah, if they think it's gone away. And boy, I read a really sobering article yesterday by an epidemiologist that, you know, the worst is yet to come. So I think we're in for a long, long ride.
Clancy made a really good point that this year they made a decision not to ask businesses for donations to support summer reading. And we've actually done the same. And I feel like I've heard other businesses say they've done the same, because I was just at a meeting with Parks and Rec, and they were talking about the normal programming that they have going on this summer that's no longer happening, and all the donations they would normally get, and not doing that. But in other ways, it's been really awesome to see how the community has still come together to support each other, even if it's not in the same way that we're used to doing. Yeah.
Well, in my town, I'm lucky because the bank and the grocery store and the hardware store, they've all got signs that basically say, look through the window before you come in. If you see over so many people, just be patient. So I'm expecting that I'll be able to do that, because my community's already trained, I guess is my best way. And that started when we entered phase 2. And it was like everyone thought, oh, well, the dam is broken. We can just go wherever we want, whenever we want. But there are medically fragile people, and especially I think in small towns. So I think just, and thanking people for wearing their mask. I mean, and for distancing and for waiting back a little bit. I think that's really important too.
I think one thing we need to be aware of is the difference in perspective. So a patron coming into the library and they're thinking, I'm going to do my one little outing here and it'll be quick. And there's not much to worry about here. Maybe they wear their mask or maybe they don't, but they're having their brief interaction, and it's probably not occurring to most of them that the staff in the building, that's just one patron, and the staff are having to have interaction after interaction all day long. And so if there's a way to communicate in a little bit more about, or help them understand that it's not just about their experience, but the safety of the staff, I think most people get it. It just doesn't occur to them right off the bat.
So the thing is the message we're going to put out is, you know, we're asking our staff to wear masks to protect our community. And in order to be able to remain open, we need our staff to also be healthy. And to make that happen, we need to all work together. That includes the asking you to wear a mask as well. You know, and to be frankly honest, and on a personal note, I have limited my business to those who are not asking their employees and their community to wear masks, because I feel like they're sending a very loud message that I don't want to be a part of that you do not care about your community. So I'm pretty passionate about this.
I totally agree with that, but I also think you have to take cues from your community. I live in a town and we have a library 11 miles up the road. McCall is the bigger community out of the two communities. Their population is about 3,000. My town's population is 130, where the Donley Library is. McCall is 15 miles up the road. They've canceled Farmers Market this summer. Donley's Farmers Market opens next Wednesday. McCall has canceled the fireworks. Donley's going forward with the fireworks. McCall, everybody is wearing masks. Donley is not wearing masks. It's a very drastically different kind of perception. And when we talk about, like, when people come into the library, I have masks at the door, and I just tell them, I can bring your books out if you choose not to wear a mask, or you can look for your own books if you wear a mask. That's all I can do, but I don't want to be the mask police at the door. Because McCall already has a bad perception for the masks. Everybody's like, I don't want to go to McCall. They're making everybody wear masks. And so I know it's all a matter of perception, but you also have to read your community, and my community is not wanting masks. So I'm doing the best I can to protect us, but I also am not going to be my neighborhood community, the neighboring community, because that's not what my community wants.
Well, and I think that's a good point, Sherry. Your community sounds like it's like a giant family reunion. I mean, it's a much smaller, and hopefully less mixing of people, like, whereas Jane knows she's going to have visitors from all over the world coming in to her community, it's maybe not as likely that you will. So I think that's a really good point to make, is that and I argue that all the time. So as I'm expounding my own 2 cents, I fully agree that this is a local thing. It's a local decision. Like so much of what we do, we can bounce ideas off of each other and we can help support each other, but in the end, it's all local, and how we look at things locally is a definite lens we have to be looking through every minute.
Can I respectfully disagree? We're supposed to be about information and reliable information and sources of information. And until my community is made up of epidemiologists who work for the CDC, I don't honestly care what your Aunt Molly wants to do. I mean, if we're talking about being people who say, do your research, use your information, I think it's completely legitimate for us to say, I understand this is your feeling about it, but here's the best information we have, and this is what we're going with. I don't see putting my staff at risk because people in my town aren't paying attention or, don't want to believe it.
I mean, I see that, but like Farmers Market, we've participated in Farmers Market every year for the last 3 years. And I don't see us stepping down from that this year because of COVID, because it's still going. It's still happening. Whether we're there or not as a library, it's still happening. And so then does the library really just step out and all the other businesses in town participate? Because I think in the long run, where does that leave my taxpayers? where does that leave the people that are funding the library? Because when they see that farmers market is still going and St. Luke's Hospital is participating in farmers market, the vegetable vendors are participating in farmers market, precautions have been taken for farmers market. If I step out of farmers market, where does that leave my taxpayers?
Well, it sounds like if you've got hospitals and precautions and all that, it's one thing, but I think it's a little different if you're just saying, well, you know, my community just doesn't feel like taking this seriously. Then I think that's a different topic. It sounds like you're participating in something that's got regulation and got controls, rather than just nobody in my town feels like wearing masks.
I mean, I think that it's a little bit of both. I think that we can put precautions out there, but we have a community that's just not about it. And do I disagree with that? Yeah, but is that my place as the librarian?
I think the best we can do is, I think what you're already saying.
Places to encourage mask wearing or not mask wearing.
Yeah, I think Sherry's what you're already doing, what you said. I mean, you are encouraging it.
Just playing devil's advocate. Like, it's a legit question. Is it your job as the librarian to dictate something like that?
I think it is in my facility as a manager and as the person who's responsible for the health of my employees. Absolutely. I think it is.
I fully agree with that, Annie. I mean, but I think you are doing that, Sherry. You already said you've got the masks at the door, and you're saying if you want to come in, then you need to have one on. I mean, so you're already doing exactly that, and it's a hard thing to combat. And delivering the information is what we do. One of the things we have done, which I love, is we started collecting masks from donors in the community who are making them, and we have packaged them with CDC information to combat misinformation and just general health recommendations, so that we're not only putting out information, but we're also giving out masks to our community to encourage them to wear them. So we've given out close to 50 masks so far in the last 2 weeks since we started doing this, and we've had probably 80 or 90 donated so far, and we've got more on the way. It's been such an easy thing to do for us to provide information to our community. So there are ways we can do it, and I think we're all probably doing it in different ways, but we're delivering those messages just like we're delivering, safety and health. We're delivering mental health by putting that on our page, and that's what libraries do. And we all do it at different levels. We all do it in different ways, and that's when I say local, that's what I mean. I still think it's absolutely our job to give the information that we know is the best information, which with this COVID has been an interesting challenge for all of us. Probably one of the biggest stressors we have is that the information changes every day. Probably one of the biggest stressors I have is when my staff says, when are we going to do this? When are we going to do that? And I have to say, I don't know. It's hard for librarians to say, I don't know. Even if we say, I don't know, but I can find out. I can't even say that right now. I can't say I don't know, but I'll find out. I can say I don't know, but hopefully soon I might know. It's just a way different world for us.
And what I know today won't be true tomorrow, right?
Yes.
Exactly.
I'm in one of those areas where most everybody seems to think it doesn't apply to us. There haven't been many cases, and nobody wants to wear masks. Now, the patrons that have come so far to pick up material have been our old faithfuls, and they have worn them. But, the local businesses, and it really frustrates me because I'm really big on supporting local business, and they've supported us through the years, but by golly, it bothers me when I poke my head in the door of a business and none of the workers are wearing masks. But that just seems to be the ethos here. And the fact is, a good bit of our economy is built on tourism, which means it's not just us little clan, hometown people who are, that nothing's going to happen. There are people coming here to get away from the cities where it's more common and stuff. And people just don't seem to get that could pose a risk.
I think Jane can probably speak to that too. She said they had to like basically barricade their town to protect themselves from outsiders who wanted to come and take a vacation there during the COVID, I believe is what you said, didn't you, Jane?
Oh, during the lockdown, yeah, they're in Blaine County, which is where Sun Valley, Idaho is. They had one of the very first really big breakouts. And in Idaho, license plates are numbered by your county, and Blaine County is 5B. And there were so many 5B plates in our county when I mean, it was a huge breakout for a really small town. And yeah, well, nobody in Custer County has it, so let's go to the 7C. Yeah, it's frustrating and scary.
So I just want to catch up here. Julie said that just thinking that we need to remember as librarians, while we can deliver information, we aren't setting social standards. We're not life or death. We just have to relax so we don't go crazy, which I think is right. That goes back to me saying, oh my gosh, we don't have the answer. And then Patty mentioned that they give workshops, and at the end of the workshop, by the end of the workshop, the information that they just provided was changed to a new information. And I think this rounds up nicely to, if we're moving to the end of this, like we have 9 minutes left, so we're not quite at the end. But I think it rounds up nicely back to our own mental health and keeping our own sanity through all of this, because probably that is the hardest thing, and the biggest challenge has been the unknowns of this, because librarians, most of the librarians that I know like to know. We like to know, and we like to have answers, or at least know where to find the answers, and that's been a continual thing. One of the hardest parts of what we do is not being able to have those answers. We are fortunate in our community that our community has been extremely supportive of us staying closed. And we had a childcare program in our building, and we still do, because we're part of a rec center, and we are now making decisions about our rec and our pool and our baseball starting and those things. But the hardest part for us has been the governing bodies that think we need to open. So for instance, our governor just announced that she's taking the limits off of any gatherings. So that's now a done deal. She just said swimming pools come open. We just made the decision yesterday not to open our swimming pool this summer. So how are we protecting ourselves mentally as people are from the outside poking and wanting us to be open? Fortunately, like I said, for us, I think we've had one person who was frustrated that he couldn't come in and vocalize it, and then said, I know it's not your fault. So that's like the most we've dealt with. And we've had, our community has been extraordinarily supportive of our decision to keep curbside going. But how do we do that? Is anybody, I mean, for those of you who have had to deal with some of that angst, and somebody said they almost got a physical altercation, which just still is flooring me.
That was me.
How do we guard ourselves, you know?
So, and not only how do we guard ourselves, but those incidents are the ones that we remember. We've had a few people that have called and said, why aren't you open yet? And we try to explain to them why we're not open, and they'll argue with us. Well, you're wrong. This isn't a real thing, you know, that we're not in danger if we come into the library and things like that. So that leaves the staff member with a very negative feeling. The physical altercation, especially, we had to ask somebody who was trying to use our Wi-Fi, they were blocking our book drop. And so when we went out to ask them to move, they got abusive and then got out of their car and approached our staff member and were toe to toe. And so that was not a good thing. There was some frustration on the part of both of them, and to try and defuse that situation and try and make that not be the anxiety producer as we're getting ready to open on Monday is, you know, that's one of the things that we're playing out of what if. In our staff meetings, we've said, what if we have another situation like this, and how can we head it off? And it has been decided that actually we'll take it outside and we'll sit down on the front porch with the person, so that it's not going on in front of all the other patrons that are here and all the other staff. And then we'll also talk about it amongst the staff and just try and defuse make everybody feel better about it so that that's not going home with us and keeping us up at night and things like that. So I don't know if it'll work. Hopefully, I'll let you know if it does. Hopefully we won't need it again.
I think that's yeah, a good point. And I'll bring up just really quickly. Kate mentioned that there is the next week is the library 2.0 conference online. If you haven't signed up, our own Bailee that's sitting there is one of the presenters. I am also a presenter for that. I don't know how many of you might be presenters. I don't know for that. There's a lot of stuff going on at that conference. I'm presenting on policy. Bailee's presenting on story times, online story times, or virtual story times. So lots and lots of good stuff going on there. I just went off in my office. I wanted to add to what you just said. So we just recently we've been doing a lot of training of our staff. It was for the public before we closed, but on secondary trauma and on exactly trauma-informed care of our patrons, but of ourselves as well. So if you don't know about those things, I would highly recommend. There are so many mental health agencies that will provide free training and help with that. It's also, there's online training. So if there's trauma-informed care is a really good thing, and secondary trauma is also really important. As workers who are on the front lines every day, we deal with secondary trauma all the time. So we're in these positions. So I think it's super important for us to take care of ourselves, and self-care is very, very important in our jobs. So that's my final 2 cents on that subject. I don't have any more questions. Does anyone have any scintillating last minute things to say in the 4 minutes we have left?
I just want to add that another thing that's really helped me is this right here. It's kind of crazy because I only get to see your guys' faces once a year anyways, during, like, if I get to see you at ARSL conferences, but being almost forced to connect more often and Zoom during this time has really helped me. I don't know, I feel like it's a safe space. I could just breathe. Everybody just shares their comments, and it's been a good de-stressor for me. So I've really appreciated all of this.
Somebody at one of our Peaceful Park rallies the other day said it's unfortunate that it takes a tragedy to bring us to these points. But now we've learned something new. We've learned how much we need each other even more than we thought. We've always kind of relied on each other, but how easy is it now that we can all jump on Zoom and have a meeting, knowing that it's going to be an hour and we're going to do this, and Kate's got her hand up in the air, so I think we're going to pass the mic to her before we end this thing.
I just see a couple of questions in the chat that I'm sure a number of you are wondering as well, with the very recent decision to move to online for our 2020 conference, which was a difficult one, but I think the right decision for everyone. Right now we're in daily huddles talking to whoever we need to talk to figure out how do we move it, what do we move it to, how do we lay it out date-wise, how is that going to get funded, and we're doing it as fast as possible because we know some of you are up against fiscal years and you just need to know what to do with your funding and all of that. So we're going to try to have that pulled together within a 2-week period where we can have registration back up and on track for the online. But just know that we're doing it as quickly as we can with the conference planning committee, members of the board, and a couple of organizations that are swooping in to kind of help support this, luckily. And we're still getting that figured out, the vendor, that's all part of the details that are getting worked out. Another thing I wanted to bring everybody's attention to is I keep seeing some of the same people showing up at these every time. You obviously care a lot about this community and get a lot out of ARSL, and I do too. I want to give you a heads up that the elections season is coming up. So those of you who keep showing up, you're exactly who we're looking for to get involved. This is almost entirely a volunteer-run organization, and it takes people who show up. That is the most important thing. Aside from that, you work with or for libraries and care about the mission of the association, we need you to show up and do the good work for all the rest of the people. So watch for those announcements to come out in the next week or two, and consider throwing your hat in the ring for the open positions. Nem, did you have anything for us as our admin maven here?
No. Next, we've been moving to a twice monthly schedule for these. So the next roundtable will be on the 25th of June. And if you are interested in facilitating, you have a topic in mind that you maybe can't facilitate but really think that is important, email us at, I'm going to put in our email. Just email the office and I'd love to help you get involved. Yeah, thanks for coming out today.
Hey, thanks everyone. It's always good to see faces and of the names on the lists and all we do. Have a wonderful day.
Thanks, Jenny. Thanks, Bailee. Thanks, ma'am.
Bye guys.